To me, what's been most fascinating in the surgical field has been the changes in the way we do facelifts or facial rejuvenation surgeries in the last 20 years. We've all been horrified by pictures in People magazine of various celebrities, perhaps even neighbors that aren't in People magazine, where their face is pulled tight and it looks like they stood in front of a Boeing jet engine. It's not a youthful look. It's a tight look. There's no sag, but it's not a pretty or youthful look. I think there's been an understanding as we've developed more techniques that curves are what define youth. People that want to get rid of every crease on their face are asking to look unusual. And we have to educate them as plastic surgeons that youthful curves are what we want. I ask my patients to look at young nieces or nephews and see what their faces look like, because that is youth. So, for example, when we do the mid-facial area, which tends to deflate and sag and come down and form nasolabial folds that are heavy, the answer isn't to fill in the nasolabial folds until the lip and the cheek are just one unit, like a monkey. The true treatment of that issue is to restore volume to the cheeks. And that can be done by making incisions inside the mouth and in the scalp and actually lifting the cheeks upward. Or in some cases that can be done by just applying a filler deep onto the bone up in this area to establish a curve which lifts the sagging tissues. The problem really is a deflation, not a looseness of the skin. Next, when we look in the lower face, which extends from the corners of the mouth to the collarbone, you can see all sorts of changes that happen. You can see jowling, which means the loops of soft tissue, fat and skin that's hanging down below the jawline. You can see bands in the neck. Some of this at advanced stage can be due to loose skin, but a lot of times, again, this is due to deflation. The old-fashioned techniques where you make incisions around the ears and you go under the skin and pull the skin tight is a very temporary solution. Not only does it not provide a long-lasting result, but the result it provides is merely a stretching and flattening of the curves of the face. Again, we want to establish curves. Your jawline to your neckline should be a curve. So techniques have advanced. And they've advanced so that, yes, we still make incisions around the ear, but hopefully nobody goes inside the ear anymore for that incision, because that creates a bizarre look where the cheek skin actually gets pulled over the cartilage of the ear. But we make those incisions and then we go a little bit under the skin, but mostly deeper underneath the lining of the muscles. And we pull that lining tightly, which lifts the contours up, but does not apply tension directly on the skin. Then the extra skin can be discarded at the end. In the neck, the same concept applies. We don't just pull the neck skin and leave everything else under it untouched. We actually lift the neck skin up and then take the thin muscle underneath the skin and tighten that like a hammock underneath to hug the structures of your neck, to hug the jawline. Then when we lay your skin down on top of it, we can see how much is excess and gently remove it without stretching the neck skin at all. This provides contours that typically last 10 to 20 years, as opposed to a short-term pull the skin, make the face flat, and watch the skin stretch out over the next 3 years or so.